Finding the main term is going to be important because that is the first word that you're going to look up in your alphabetic index in your ICD-10 coding manual. So what is a main term? A main term will be a condition like a fever or an infection or a fracture. It could be a disease like pneumonia or diabetes. It could be the reason for the visit, such as a screening. You find that main term in your diagnostic statement. A diagnosis is the reason why a patient visits the physician or has a procedure or a surgery. Identifying that main term will start you on the right track to finding the correct diagnosis code. Main terms are found in red letters in your ICD-10 alphabetic index. After locating the main term, you want to search for possible subterms that are indented underneath that main term. A main term will never be searched for under an anatomic body site, such as an arm or an elbow or radius or an ulna, just to name a few. So if your diagnosis code said infection of the arm, you know that arm is not your main term. Main terms are found in red letters in that ICD-10 CM alphabetic index. After locating the main term, you're going to search for possible subterms that you find in your diagnostic statements. Subterms are found in the alphabetic index, indented 2 spaces to the right after the main term. Now, sometimes in that alphabetic index, you will be guided to see condition. Now, this does not mean to look for the word condition in the index. It means to look for the condition in the diagnostic statement that the patient has. Maybe it's a fracture. Let's try a few together. We want to identify the main term in the diagnostic statement, acute respiratory distress. Now ask yourself, what is the condition? The patient is in distress. Now let's look distress up in our ICD-10 coding manual in the alphabetic index. Remember, it's going to be in red. And then we're going to want to look up the subterms, which just gives more information about distress. Now, the good thing about a video is you can pause me until you find distress, and then you can hit play again. So, the subterms that we'll be looking for under distress are respiratory, which is the location of the distress, and acute, which is the timing of the distress. Let's identify the main term in these 3 diagnostic statements. Acute myocardial infarction of the left anterolateral wall. So, what's the condition that the patient is experiencing? It's an infarction. So, the main term is infarction in acute myocardial infarction of the anterolateral wall. Now, myocardial is where the infarction is occurring. It's in the heart muscle. Acute is the timing, and then anterolateral wall is just a little bit more information as to where it is in the myocardium. Let's look at this one. Bilateral central corneal ulcer. So, what is the condition that the patient is experiencing? It wouldn't be bilateral because that is where it is. It's in both eyes. Central is a little bit more information about where it is. Corneal it's in the cornea. So the main term in bilateral central corneal ulcer is ulcer. So you would start looking up in your ICD-10 coding manual the main term ulcer, and then look up your subterms. Okay, look at this one. Acute non-suppurative otitis media of the right ear. Can you identify the main term in this diagnostic statement? If you chose otitis media, you are correct. The other words in this statement are merely subterms giving more information about the otitis media. Now, subterms, remember, are words that describe the main term. In the infarction, it was acute myocardial anterolateral for the subterms. In the ulcer, the subterms were the cornea, central, bilateral. And then in otitis media, it was non-suppurative, acute, and right ear. Now, if you need help when you're working through your assignments and things, you can always contact me. I'm available 9 a.m. to 9 p.m. Eastern Standard Time any day of the week. I'll do my best to answer when you call. If not, just leave a message and I will call you back. We have academic facilitators. You can reach them by calling 888-215-8215. We have learning labs. Every day you can find many learning labs. You go to your Student Success Center and then just click on Join a UMA Learning Lab, and then a list comes up for the day, whatever day that you have picked, and then you'll just click on the one you want to go to. This one, for example, is November 1st at 2 p.m. and these times are always in Eastern Standard Time. So on November 1st at 2 p.m. there's a MBC, Medical Billing and Coding, open session. When you click on this, it opens up a screen. It gives you the link and also the telephone number to dial in if you just want to call in. All of that didn't show up on my click, but when you do click it, it will. So make sure that you take advantage of all these opportunities that you have for lots of help, because we want you to be successful in this program. Now, put finding the main term into action. You can watch the video that I made for you. It's found in your student materials folder, and it's called How Do I Look Up a Diagnosis? Thank you.